Bismillahirrahmanirrahim. Welcome to the new episode of Medical Research Made Easy. Today we are going to discuss the analytical studies. The analytical studies are of two types, the observational and the experimental studies. In observational studies, the researcher does not actively intervene and the research or study is based on observations only. While in experimental studies, the researcher actively intervenes into the group. He may or may not add a drug or a trial into a group. The observational studies are basically of two types, either case control or a cohort study. So today we will discuss the case control studies. The case control studies are usually the first approach to test a causal hypothesis. The case control studies are basically comparative study. The cases having the disease are compared with controls not having the disease in relation to a supposed causal factor. They are retrospective studies as both exposure and disease have already happened. So while you are selecting the cases should be defined in terms of extent, severity and stage of disease. The controls must be free from the disease. The controls must be similar to cases except for the presence of disease. It is not important to take equal number of cases and controls. The controls may be taken usually up to the 4 times the number of cases. The controls may be taken from the same hospital, neighbors, relatives or general population. The cases and controls must be matched and confounding factors must be addressed. So now let us see what are the confounding factors. A factor, although associated with exposure under investigation, which itself is independently a risk factor for the disease, is a confounding factor. This definition will be further explained from the following examples. If a researcher is doing research on the role of alcohol in the etiology of esophageal cancer, so in this research, the smoking will be a confounding factor. Because although smoking associated with exposure, that is alcohol, is itself a risk factor and independent risk factor for the esophageal cancer. So the cases and controls must be matched in relation to the smoking. The second example is the relation of steroid contraception with breast carcinoma. So in this study, while selecting the cases and controls, the age of the patient and the controls must be matched because the breast carcinoma is usually present above 40 years of age. If in the controls the researcher will select the young patients below 30 or 20 years of age, there will be a objection in the study and it will be biased because of the confounding factors. So this is the classic 2x2 model of the case control study. And let's understand the analysis of the case control study based on this model. So we see this, the classic example of smoking in the lung cancer. 100 cases are taken with lung cancer, 100 controls are taken who are healthy. So in 100 cases, 80 patients they smoke, we label it as A, and 20 do not, we label it as C. While in controls, 40 patients smoke, we label them as B, and 60 patients that do not smoke, and we label them as D. So one of the analysis in the case control studies is the exposure rate, and exposure rate is calculated among cases by the following formula: A plus C multiplied by 100, then result comes 80%. So the exposure rate of smoking among cases of lung cancer in this example is 80%. 80% of the patient with lung cancer they smoke. This is the exposure rate of smoking among controls. It will be calculated by the same formula, B plus D multiplied by 100, and the result is 40%. So we can say that the controls, 40% in controls, the 40% smoke, but they do not have the lung cancer. So the exposure rate of smoking among controls is 40%, while the exposure rate of smoking among cases is 80%. So this exposure rate, it only gives us a crude idea. Basically, the important statistical test in case control studies is the odds ratio. So now let us see what is the odds ratio. Odds ratio basically quantifies the strength of association between two groups or events. It is defined as the ratio of the odds, which means the chance or the probability of A, for example, we said lung cancer, in the presence of B, smoking, and the odds or the chance of lung cancer in the absence of smoking. So we have to calculate a ratio of the chances of lung cancer in the absence of smoking and the chances of lung cancer in the presence of smoking. So if we calculate the odd ratio and it is equal to 1, it means that two events are independent to each other and the causal hypothesis will be rejected. If the odd ratio is more than 1, the presence of B, it means that the presence of B raises the chances or odds of A. The presence of smoking increases the chances of lung cancer and shows a possible causation. If the odds ratio is less than 1, it means that two events are negatively correlated and no causation exists. Rather, a protective role of the factor under study exists to the disease. So how to calculate the odds ratio in the same example that we have already discussed. The odds ratio is basically calculated by a cross multiplication in the same 2 by 2 case control table. So it will be calculated by AD oblique BC, and in this example the result is 6. So it's more than 1. It means that there is a strong correlation between smoking and the lung cancer, and we will say that in smokers the chances of having lung cancer is 6 times more than the controls. So if anyone is smoker, he will have 6 times more chance of having the lung carcinoma as compared to non-smoker. So this is a real life example of the case control study, which is a historical example. The adenocarcinoma of the vagina, which is seen in old women, it's a rare disease. It was seen in 1966 to 1969 in Boston City. 8 cases of young girls between the age of 15 to 20 years of age who were born in the same hospital. They presented with the adenocarcinoma of the vagina. A case control study was conducted in 1971. 4 controls for each patient were taken from the same hospital. The information was collected by personal interview, maternal age, smoking, antenatal radiology, and a drug which was supposed to be a causal factor. The maternal exposure of diethylstilbestrol during fetal life was recorded. Surprisingly, 7 of the 8 girls had diethylstilbestrol exposure during fetal life, and that drug was given to the mothers basically during their first trimester to prevent miscarriage. So later many similar cases of adenocarcinoma in the young girls were reported, and it's now confirmed that maternal exposure of estrogen during pregnancy can cause adenocarcinoma of vagina in girls many years later. So what are the advantages of the case control study? They are basically cheap, they are easy to carry out, and they are rapid to conduct. They are suitable to investigate rare diseases. There is no major risk and no ethical issues are involved, and many risk factors can be studied at one time. The disadvantages are that there can be selection bias, as you have to select the controls yourself. So you may deliberately, anybody can skip the factor which can alter the results. There can be memory or recall bias because it's a retrospective study built based on history and interview. There can be bias due to confounding factors, as already discussed, and the main disadvantage in case control study is that the incidence cannot be measured, and so the important statistical test, the relative risk, it cannot be calculated in the case control study, and relative risk is calculated in the cohort study, and that difference we will see in detail in the next video. So that's all for today. Thank you very much. In the next video we will learn about the cohort studies and the main differences between the case control study and the cohort study.